Right. I'm going to be straight with you. Most blokes don't realize that their penis ages just like their heart, brain, or bones do. And here's the thing that might shock you. Ignoring this doesn't just mean losing function. You lose confidence, dignity, and connection. But what if I told you the main cause of penile dysfunction in men over 60 has got nothing to do with age itself? That a simple daily routine, not medication, could change everything. I'm Dr. Sophie Caldwell, and I've spent over 30 years working with men just like you. And today I'm going to share 5 absolutely crucial rules that most men get wrong. Before we dive deep, let me give you a quick preview of what we'll cover today. First, we'll talk about proper hygiene and why what worked in your 30s doesn't work now. Second, what you wear to bed matters more than you think. Third, we'll discuss staying active and why movement is medicine. Fourth, I'll explain hydration in a way you've probably never heard before. And fifth, the most important one, we'll talk about maintaining sexual activity and why regular checkups are non-negotiable. Stay with me till the end, because that 5th rule is the one most men completely miss, and it's perhaps the most important of all. Now, I know what some of you are thinking. You've lived 6, 7, maybe 8 decades without anyone telling you how to look after yourself down there. And you're doing just fine, thank you very much. I've heard it countless times in my clinic, but here's what I've learned over 3 decades of practice. The men who pay attention to these things, who make these small adjustments, they're the ones who maintain their quality of life, their relationships, and their confidence well into their 70s, 80s, and beyond. The truth is, your body changes. That's not weakness. That's not fragility. That's just biology. Your skin becomes thinner and more sensitive. Blood flow changes. Hormone levels shift. The immune response isn't quite what it was. And this means that what counted as good enough hygiene when you were 30 or 40 simply isn't sufficient anymore. I'm not saying you were doing it wrong before. I'm saying the game has changed and you need to adapt your approach. Let me start with the first rule, and it's about hygiene. Now, I know you're probably thinking you know how to wash yourself, and I'm sure you do. But hear me out, because this isn't about being dirty. It's about understanding that your skin's needs have changed. After 60, your skin produces less natural oil. It's more prone to irritation. Small tears and breaks in the skin take longer to heal. And bacteria that your body used to fight off easily can now cause problems. Here's what I recommend, and I want you to be quite specific about this. Every single day when you're in the shower, you need to gently retract the foreskin if you're uncircumcised and wash thoroughly with warm water. Notice I said warm water, not hot. Hot water strips away protective oils and can cause dryness and irritation. Use a mild, fragrance-free soap, and I mean genuinely mild. Those heavily scented shower gels and soaps, they're causing more harm than good. They contain chemicals that can irritate sensitive skin and disrupt your natural pH balance. After washing, and this is crucial, dry yourself completely. I can't stress this enough. Moisture trapped under the foreskin creates the perfect environment for bacteria and fungi to thrive. Pat dry gently with a clean towel. Don't rub vigorously. Your skin is more delicate than it used to be, and rough toweling can cause micro tears that lead to infections. Some of my patients have found it helpful to use a separate, designated towel just for this area. Keep it clean, wash it regularly, and replace it often. And here's something most men don't know. If you notice any redness, unusual discharge, persistent itching, or an unpleasant smell that doesn't go away with proper washing, don't ignore it. These could be signs of an infection that needs treatment. I've seen too many men put off seeking help because they're embarrassed, and by the time they come to see me, what could have been sorted with a simple cream has become a significant problem. There's no shame in getting these things checked. It's just basic healthcare. Right, let's move on to the second rule, and this one surprises most of my patients. What you wear to bed matters. Specifically, I'm talking about sleeping naked, or at the very least wearing loose-fitting boxers. Now, I can see some of you raising your eyebrows, but stay with me because the science behind this is quite solid. When you wear tight underwear, especially synthetic materials, you create a warm, moist environment. That's exactly what bacteria and fungi love. Throughout the day, it's sometimes unavoidable. You're dressed, you're out and about, you've got to wear something. But at night, that's your opportunity to give your body the ventilation it needs. Your genital area needs to breathe, to stay cool and dry. I've had patients tell me they've slept in pajamas or tight pants their entire lives, and they're fine. And perhaps they have been. But I'll tell you what I've observed. Men who switch to sleeping without constrictive clothing report fewer skin irritations, fewer infections, and generally better comfort. One of my patients, a chap in his 50s, told me recently that he'd been sleeping naked for several years now, and it's made a world of difference. He said, and I quote, "It's just better." And after his divorce, he mentioned it's even more brilliant. The point is, when you're in bed, let everything relax and breathe. If you're not comfortable sleeping completely naked, that's fine. Wear loose cotton boxers. The key word is loose. Nothing tight, nothing synthetic if you can help it. Cotton allows air circulation and absorbs moisture, and for goodness sake, change them daily. I know that sounds obvious, but I've met men who didn't think it mattered. It does. The third rule is about staying active. And I don't just mean going for a walk once a week. I mean regular, consistent physical activity. Now, I'm not suggesting you need to start running marathons or lifting heavy weights at the gym. But you do need to move your body regularly, and here's why it matters for your sexual health. Blood flow. That's what it all comes down to. An erection is fundamentally about blood flow. When blood vessels are healthy and flexible, when your circulation is good, everything works better. And what keeps your blood vessels healthy? Exercise. Regular physical activity improves cardiovascular health, reduces inflammation, helps maintain healthy blood pressure, and keeps your blood vessels flexible and responsive. What kind of exercise am I talking about? Walking is brilliant. Aim for at least 30 minutes a day, 5 days a week. If you can manage more, even better. Swimming is excellent because it's low impact and works your whole body. Cycling is good too, though do make sure your saddle is properly fitted to avoid putting too much pressure on your perineum. Gentle resistance training with light weights or resistance bands helps maintain muscle mass and bone density, which both decline with age. But here's the thing, consistency matters more than intensity. It's better to walk for 20 minutes every single day than to do one massive workout at the weekend and then collapse on the sofa for the next 6 days. Your body needs regular stimulation to maintain healthy blood flow. Think of it like this. Your cardiovascular system is like the plumbing in an old house. If you run the water regularly, keep things flowing, everything stays in good working order. But if you let it sit stagnant for long periods, things start to seize up. And whilst we're on the subject of activity, let me mention something that's often overlooked. Pelvic floor exercises. Yes, I know that's something you've probably heard associated with women, but men have pelvic floor muscles too, and strengthening them can make a significant difference. These muscles support bladder and bowel control, and they play a role in erectile function. You can do these exercises anywhere, anytime. Tighten the muscles you'd use to stop urinating midstream. Hold for a few seconds, then release. Repeat 10 to 15 times, several times a day. It sounds simple, and it is, but the benefits are quite real. Now, the fourth rule, hydration. I know, everyone bangs on about drinking more water. But let me explain why it's particularly important for your sexual health. Proper hydration affects every single system in your body, including your reproductive and urinary systems. When you're well hydrated, your blood volume is optimal, which means better circulation. Better circulation means better blood flow to all areas, including your penis. Dehydration makes your blood thicker, which makes it harder for your heart to pump it efficiently. It also affects hormone production, energy levels, and even your skin's ability to stay healthy and resilient. Here's what I recommend. Aim for about 2 liters of water a day. That's roughly 8 glasses. Now, you might need more if it's hot, if you're exercising, or if you're taking certain medications. And please, I mean water. Not tea, not coffee, not fizzy drinks. Those can contribute to your fluid intake, but they shouldn't be your primary source of hydration. Coffee and tea are diuretics, which means they actually increase urine production. Fizzy drinks are often loaded with sugar or artificial sweeteners that can cause their own problems. Pay attention to your urine color. If it's pale yellow, almost clear, you're well hydrated. If it's dark yellow or amber, you need to drink more. And here's a tip. Don't wait until you're thirsty to drink. By the time you feel thirsty, you're already mildly dehydrated. Make it a habit. Keep a water bottle with you. Drink a glass when you wake up. Drink a glass before each meal, and so on. Some of my patients worry about drinking too much because they don't want to be running to the loo all night. Fair enough. Here's what I suggest. Do most of your drinking during the day and early evening. Taper off a few hours before bed. That way you stay properly hydrated without disrupting your sleep. Right. Now we come to the 5th rule, and this is the one that makes the biggest difference, but that most men are reluctant to talk about. It's about maintaining sexual activity and having regular medical checkups. Let me address both parts. First, sexual activity. There's this pervasive myth that as you get older, sexual activity naturally declines and eventually stops. And that's just how it is. Rubbish. Complete rubbish. Yes, things change. You might not have the same spontaneous drive you had at 20. Things might take a bit longer. But sexual activity, intimacy, physical connection, these can and should continue throughout your life. And here's the crucial bit. Regular sexual activity, whether with a partner or through masturbation, actually helps maintain function. It keeps blood flowing to the tissue. It helps maintain sensitivity. It keeps the mechanics in good working order. I've seen this time and time again in my practice. Men who remain sexually active tend to maintain better function than those who stop because they think they're supposed to, or because they're embarrassed about changes in their performance. If you're having difficulties, if erections aren't as firm as they used to be, if it takes longer to achieve one, if you're experiencing premature ejaculation or the opposite problem, delayed ejaculation, these are all treatable issues. But you have to actually talk about them. I cannot help you if you don't tell me what's going on. And I promise you, there's nothing you can tell me that I haven't heard before. After 30 years in this field, I've heard it all. And there's absolutely nothing to be embarrassed about. Now, the second part of this rule, regular checkups. I'm talking about seeing your GP or a urologist regularly, not just when something's wrong. Preventative care. After 60, you should be having your prostate checked annually. You should be monitoring your PSA levels if appropriate. Any changes in urination, any pain, any blood in your urine or semen, these need to be investigated promptly. I've had patients tell me they don't want to bother the doctor, or they're too embarrassed, or they figure it'll sort itself out. And I'll tell you the same thing I tell them. Early detection saves lives. Prostate cancer, bladder cancer, testicular problems, infections, all of these are far more treatable when caught early. And the actual examination, it takes minutes. A bit uncomfortable perhaps, but it could literally save your life. The same goes for any sexual health concerns. If you're sexually active with a new partner or multiple partners, get tested for sexually transmitted infections. Yes, even at your age. ST is don't care how old you are. I've diagnosed infections in men in their 70s and 80s. Practice safe sex. Use protection. And if you do contract something, get it treated. Most STIs are easily treatable if caught early, but they can cause serious complications if left untreated. Let me also mention something about communication. If you have a partner, talk to them about these things. I know it's not comfortable. I know it might feel awkward. But open communication about sexual health, about changes in desire or function, about what feels good and what doesn't, this is crucial for maintaining a healthy, satisfying, intimate relationship. Your partner isn't a mind reader. They need to know what's going on with you. And if you're experiencing erectile dysfunction, don't just accept it as inevitable. There are so many treatment options available now. Medications like sildenafil, which you might know as Viagra, can be remarkably effective. There are other medications, there are devices, there are therapies, but none of them work if you don't seek help. So let me recap what we've covered today, because these 5 rules work together. First, proper hygiene with gentle daily washing and thorough drying. Second, wearing loose clothing, especially at night, to allow proper ventilation. Third, staying physically active to maintain healthy blood flow. Fourth, proper hydration to support all your body's systems. And fifth, maintaining sexual activity and having regular medical checkups. These aren't complicated things. You're not being asked to completely transform your life. These are small, practical adjustments that fit into your daily routine. But the cumulative effect of doing all 5, that's where the real benefit comes in. Because your penis isn't separate from the rest of your body, its health is connected to your overall health. Good cardiovascular health supports sexual health. Good hydration supports tissue health. Regular activity supports blood flow. It's all connected. I want to address something before we finish. Some of you might be thinking, I'm too old for this to matter. Or, what's the point? And I want to be quite clear about this. You're never too old to take care of yourself. I have patients in their 80s who are sexually active, who maintain their health, who live full, dignified, confident lives. Age is not a barrier to sexual health and function. Changes are normal, but dysfunction is not inevitable. Your quality of life matters. Your confidence matters. Your relationships matter. And these things are worth investing in, worth caring about, worth making small daily efforts to maintain. You're not being vain or silly for wanting to maintain your sexual health. You're being smart. You're being proactive. You're taking control of your own well-being. And if you're struggling, if you're dealing with changes that worry you, if you don't know where to start, please know that you're not alone. I've worked with thousands of men over my career, and virtually every single one of them has had concerns, questions, or struggles at some point. It's completely normal. What's important is that you don't suffer in silence. Reach out to your doctor. Have the conversation. Get the help you need. I'd love to hear from you in the comments below. How old are you? Which of these 5 rules resonates most with you? Are you already doing some of these things? Have you noticed a difference? Building a community where men can talk openly about these issues is so important. We all learn from each other's experiences. So please share your thoughts, ask your questions, and if you found this helpful, do subscribe to the channel. I'll be making more videos addressing common questions about men's health, debunking myths, and providing practical advice based on 3 decades of clinical experience. Remember, you're not just a passive observer of your own aging. You have agency. You have control. These 5 rules, these simple daily practices, they're your tools for maintaining your health, your function, and your quality of life. Your body is changing, yes, but it's not failing. It's evolving. And how you care for it now matters more than ever. Thank you for being here, for listening, and for making the decision to invest in yourself. That takes courage, and I commend you for it. Take care, and I'll see you in the next one.